Morning, Richard Buckley, Milford, MD. Today we're back here in the procedure room. What are we doing today? We're doing inner thighs. That is to say, we're taking some fat and sculpting it down and smoothing it out. And also the inner knees. It's an area that in women loves to have a glob of fat. That is going to be toast today. We're getting rid of that. Another thing that's quite common on the whole inner aspect, especially the inner aspect of the thighs, is looseness. And with looseness, things kind of hang down a bit and have more of a tendency, let's say, to touch in the center or chafe. And so we ought to try to do something to get some tightening. Tightening also probably implies a little lifting as well. Lipo alone will not do that, so we have to do something else. We do have lasers. We actually have 40 lasers here, but we have some that are nice for let's say laser lifting during a lipo, laser lipo lifting, it's alliteration, I believe. For example, the Smart Lipo Triplex laser is very nice for that. More recently, I think as of 23 last year, we're using the Renuvion device, which generates plasma energy at its tip here. And wherever the magic wand is underneath the skin, it's delivering a very robust tightening treatment. I think it's probably the most serious tightening treatment, aka doing some lifting as well, treatment that we have. We use it in conjunction with sucking fat out. So Renuvion is for tightening, is not for sucking fat out. Sucking fat out, liposuction, is not just one thing where you hook up a hose. You should use tiny little tools. I have an assortment here. I'm just grabbing a couple at random to show you. I have much longer ones, bigger ones. I have much tinier ones. They have, not that you're interested, but they have little configurations at the end of holes. So that's 2 slots. It's known as a finesse cannula. There's another finesse cannula, but it's a little bigger. This one was invented by Gerhard Sattler in Germany, and so it's called a Sattler. It's sort of a little row of holes around it. This one is invented by the inventor of tumescent anesthesia. Are you awake?
Yeah.
Having fun?
I am.
Yeah. So we have an awake patient having fun, and that's all made possible by our sponsor. Yeah, well, sort of, yeah. Dr. Jeff Klein in California, who invented tumescent anesthesia. Not only an MD, he's also a PhD pharmacologist. So he was able to show the world, I think starting in '87 and especially a little later in the '80s, how we could do significant numbing in areas of the body that historically maybe people had some general anesthesia in order to be treated for. So I mean, people have had lots of general anesthesia for liposuction. It's just never ever necessary in our experience. And so our patient's awake, going to stay awake. This whole inner thigh and this inner knee is numbed up. You can see it's a little whitish compared with the area out here, which is a little more pinkish. You can see there's a border there between white and pink. That's numbed, that's not numbed. This leg is also numbed. So I'm going to treat that. Liposuction for sculpting, Renuvion for tightening. Then we're going to go and do the upper arms as well. Maybe I'll bring you back to show you that. So thank you for watching another episode of Milford, MD.